Okay, so this video I'm going to explain to you if you're struggling to get an aspirate, a pH aspirate of 5.5 and below. It doesn't necessarily mean your tube's in the wrong place. You could possibly be on an antacid like omeprazole or lansoprazole. So what we would suggest is that if you are on one of those antacids, that you take that in the night before bed, just to prevent the acidity of the aspirate being changed. So you can discuss that with the radiotherapy team or your oncology team or us here at the patient support unit. What else you can do is that if you've got a safe swallow and you're struggling to get a pH below 5.5, as long as you have that safe swallow, you can take a sip of water, and what that can sometimes do is stimulate the gastric juices and help to bring down that pH down below 5.5, which is the required response that we want. If you're being stated by speech and language therapy that you are nil by mouth, this method is not suitable for you. What else you can do is that, again, if you've got a safe swallow, you can do something called the coloured liquid test. So firstly, with these nasogastric tubes, we insert it to a certain length that's going from your nose into your stomach. And when we place the tube, we mark near your nose at the length that it's been inserted. So as long as that's unchanged, what you can do, and as again, like I said, if you've got a safe swallow and are able to manage blackcurrant squash or orange squash, you can do a coloured liquid test. Okay, please note that if you've been advised by speech and language therapy that you are nil by mouth or water only, this method is not suitable for yourself. If you take a sip of a coloured liquid or a milk or tea, something that's clearly visible for you to see, you can take a sip, let that go down into your stomach. Once it's hit your stomach, leave it for a couple of seconds, and then what you can do is attach a 20ml syringe to your nasogastric tube and try and aspirate back up or draw back up your tube that coloured liquid. Now if you can see that coloured liquid, like blackcurrant squash is clear to see, and that tube length is unchanged, that is a perfectly acceptable response to identifying that tube is in the correct place. When we place the nasogastric tube, we also give you these information booklets. Now within these booklets are all sort of hints and tips in managing your nasogastric tube, and if you have any problems in regards to pH testing or anything else blocking, anything else that's an issue, you can relate to this book, or you can give us a call at the patient support unit or the treatment helpline at Velindre Hospital.